Your adrenal glands are located on the top of each kidney. Now, these glands produce hormones that you can't live without, including sex hormones and cortisol, which helps you respond to stress and has many other functions. Adrenal disorders can cause your adrenal glands to make too much or not enough hormones. Now, some of us are born unable to make enough cortisol. Tumors can also cause disorders in your adrenal glands. Bleeding and infection can cause an adrenal gland problem that can be fatal without quick treatment. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. Dr. Maha Zikra of the Diabetes and Endocrine Center of Florida is here to tell us a little bit about adrenal disorders and the mystery around them. Dr. Zikra, you are a board-certified endocrinologist.
Yes.
So tell us exactly, what is the endocrine system and what do you do as an endocrinologist?
Yes. Endocrine system involve all the glands in the body that secrete hormones, and those hormones play very crucial roles in our well-being, blood pressure, our appetite, our stamina. So it's very crucial for the life. So it really, endocrine system deal with all the hormones that our glands secrete, like pituitary, adrenal gland, pancreas secrete insulin also, which
So the adrenals, the pituitary, your pancreas,
right,
everything.
the ovaries, the testicle for the male is all under endocrine system.
Okay, so you have a specialty where you can't actually see the thing that you specialize in. So when someone has a disorder of the adrenal glands, what signs and symptoms do you look for?
Yes, actually there's a two disorders of adrenal gland, either hyperfunctioning,
Hyper, so
right?
too,
So
is
that
too
means there's a
much.
too much hormonal secretion, for example, like Cushing.
Cushing's,
And the patient
okay.
will come with obesity, like gaining all of a sudden 30, 40 pounds, excess hair growth, feeling weak, osteoporosis, or the other way is really hypofunctioning,
Too low.
too low.
Okay. And what are the symptoms of that?
Right. Hypofunctioning, the adrenal gland can sometimes atrophied, and then it stops secreting hormone, we call it cortisol hormone, which lead into sudden weight loss, very poor appetite, and severe fatigue.
Okay, so hypo means
Low secretion
low
of
and
the
of
hormones.
cortisol,
Yes.
which, when you hear the commercials about too much gives, the girth around the middle, but too little means people are losing weight too fast.
Absolutely. We call that, there's a two kind of low cortisol hormone disease. One is Addison disease, where our body attack our own adrenal gland. We call that autoimmune disease. And then the adrenal gland will atrophy and stop secretion of cortisol hormone, and another hormone, we call it also aldosterone hormone.
Well, let's talk about Cushing's. You mentioned Cushing's
Yes.
first. What are the symptoms of Cushing's?
Yes. Symptoms of Cushing, which is excess cortisol secretion, the patient will have weight gain, will all of a sudden have diabetes, hypertension, excess hair growth, and moon face, and usually hump on the back.
Moon face. What is
Yes.
that?
Mean like really, when you look into the face, it really look very rounded like a moon, like puffy cheek, and
Okay.
also kind of red color erythema on the skin of the face.
So eczema and puffiness
Erythema,
in the
yes,
face.
mean like reddish face.
And a hump in the
Yes,
back?
it can have hump on the neck.
Okay.
Right.
So that's
And-
Cushing's.
yes.
What about Addison's?
Addison is the opposite, mean the adrenal gland stop secreting cortisol hormone and aldosterone hormone. So the patient will have hypotension, they can get dizzy,
Which
and they
is
don't know,
low
like dizzy
blood
spell.
pressure.
Yes. They can also go into low sugar, and we call that hypoglycemia. They can faint. And also they will complain about very severe fatigue to the level they can sometimes not able even to move out of their bed.
Okay, so
and significant weight loss
the
as well.
tiredness is just
Very
debilitating.
severe, yes.
Okay.
Yes.
So are there some groups of people or some genders, age groups, racial groups that are more predisposed to adrenal disorders than others?
It can happen in any age, and it can happen to male or female. There's no one predominant exposure to the other. But since it can happen in any age, we should think about it could be low cortisol hormone that really we need to check it.
Okay. Are the symptoms, some of the symptoms that you mentioned can be confused for other
Pretty
things?
much.
So how do you as an endocrinologist know when someone has Addison's or Cushing's or any of the other things that affect the adrenal system?
Usually the patient will refer to me from the primary care physician because they will tell the patient, maybe you have depression, that's why you are very tired. Well, maybe you have cancer, that's why you're losing a lot of weight, and let's do all those, full lab, full evaluation. And then the patient will say, well, I need to see an endocrinologist, maybe she will solve the mystery for me. And then when I go over, you question the patient, I'll put, all those symptoms together and sign, and it just come to my mind that really let me check those hormones, the cortisol hormone.
So a lot of times a specialist who does not specialize in endocrinologists may think
Yes.
it's depression
Right.
or cancer.
They confuse it with like something more serious like cancer. Yes.
Is this something that people can live with? Can you live with an adrenal disorder? Is it fatal?
If untreated, it could be really very debilitating. To the level patient can have a shock, severe hypotension, and can die. Yes,
Okay.
it can. But when we treat it, and it is simple hormonal replacement with tablet, patient will live very normal life and go back to their norm, go back to their energy, gain weight again, and they will live really very happy after that.
So if someone has an adrenal disorder, are they more likely to show symptoms of another disorder affecting the other glands in the endocrine center at some future date?
Yes, they can. It's not 100%, but since adrenal insufficiency, we consider part of the cause is autoimmune disease, so they can prone to another autoimmune disease like hypothyroidism, lazy thyroid gland, or even infertility or diabetes.
So what do you recommend for people who are watching and are going, oh my goodness, that sounds like me, maybe that's what's going on? What's the first thing they should do?
Don't stay home and say, that's it, I have no solution to my problem. Or don't say, oh, it's a really depression. Always, sometimes seek further help. So usually endocrinologists who take care of the hormones and the diabetes, it's really the right source. And always ask your doctor what could be other than the superficial, oh, it's a chronic fatigue that I should accept it and live with it.
Okay.
So always look for what could be the possibility and ask your doctor, like, would you refer me to, for example, endocrinologist, or it could be hormonal issues, and be aware of your symptoms. Google it on the internet. That would be very helpful.
Okay.
Because sometimes if you put just fatigue and what the possibility, you Google the word fatigue or weight loss, it will give you all the possible. Part of it is adrenal insufficiency, and I find that very helpful for my patient.
That's interesting. Never heard a physician say Google it. What
Yes.
I am hearing from a lot of physicians is that people have to be more proactive
Yes.
about asking questions and not
Yes.
just accepting a diagnosis.
None
You
at
have to
all.
be
Search
your own
for.
biggest advocate.
Absolutely. Search what could be the cause.
And so how do you test for these? Is it a simple blood test?
Simple blood test, and I can measure the blood test for the cortisol hormone level. And within like 2 days, I will know the result. And usually, if I suspect the disease, I start the treatment even in my office. I don't let my patient leave the door without having prescription of synthetic cortisol hormone replacement.
And this is something that if treated early enough,
Yes.
people can live full
Yes.
lives with it.
Absolutely. And
That's
never
the
late
best
for
news.
the treatment also. Never late. Whenever we diagnose it, we treat it. But that disease, adrenal insufficiency or Cushing, could go sometimes for a few years undiagnosed.
Well, hopefully not anymore.
Yes.
Not that we've heard from you
Yes,
about what we
hopefully.
should be looking for.
Hopefully.
Dr. Zikra, thank you very much for being with us.
Thank you for having me.
And when we come back, we're going to meet some folks who've actually had personal experience with adrenal disorders and find out how they're coping. You don't want to miss it. The National Adrenal Diseases Foundation is an organization designed to help people with these disorders, and we're here to talk to Kalina Warren, who is the president of the organization. Thanks for being here.
Well, thank you for inviting me.
How did you get involved with NADF?
6 years ago, a family member was diagnosed with Addison disease. It was quite traumatic experience for the whole family. None of us were familiar with this disease. We really didn't know anything about it. So having a family member in a hospital being diagnosed with that, it's quite shocking. You are not certain what's in the future, what does it mean to your life. And that's when, by searching internet, I found information about NADF and contacted them and asked questions. I wanted to talk to a real person that experienced that disease, and that gave us a lot of comfort.
So tell me what it is that you do as a foundation for people who are battling all of the complications that come from a diagnosis like that. What does NADF do for people?
Our biggest part of our efforts is actually to focus on helping patients that are newly diagnosed. Just like in my case, when we were shocked after the diagnosis was told us, you have a comfort in talking with other people that experience similar problems.
So it takes a little bit of the worry away because you know you've got somebody who gets what you're going through.
Absolutely. The doctors really do not have time to go into details. Usually you just receive the prescription, you are told take your medications daily, see endocrinologist in 3 months and do your blood work, and that's about it. But you really don't know what it means. How do I survive next day?
Right.
Can I change my diet? Can I continue to work? Can I continue to exercise? What about my vacation plans? Should I change any of that?
Just life.
So just normal life,
Right.
right. All of a sudden, all of that is in a big question mark. But having to talk to another person that went through the same problems, it's very comforting.
What was life like for you with the family member who was diagnosed? Before you knew what was going on, what were some of the things that were showing up that were of a big concern to you?
After the diagnosis was done, we were thinking back, and all of a sudden the picture started to emerge much more clear. There were symptoms that we all overlooked. If your adrenal glands don't work correctly, if you have adrenal insufficiency, your body doesn't produce enough hormones that are necessary for your daily activities, for your metabolism, for your level of sugar, for your blood pressure.
So is this person tired all the time?
Right, so it's causing being tired, maybe loss of appetite, maybe back pains. If it reaches the point that it's crisis, you might start vomiting, and your blood pressure goes really, really down.
So some of these symptoms, people just kind of say, oh, well, I'm just tired.
Right.
I just need to go take a nap. I've been working too long. But you noticed that after it kept going on and on and on, something needed to happen.
Actually, we reached almost the crisis point. that's when a small flu or a cold even really adds additional stress on your body. And without cortisol, your body is not capable of fighting that. That's when you go down all the way to crisis. And you are so weak, you cannot really walk, you can barely talk, you feel dizzy, and that's when really you need to go to a hospital and to emergency room.
So when you have your meetings, your community outreach, do you have times where people sit around and actually talk about those things and actually support each other through that?
We have over 40 support groups throughout the countries. All of them are run by volunteers, like me. They are organized in different ways, but the focus is to help each other, to talk about each other's experience. Some of them invite doctors during the meeting. Some of them meet quarterly, some annually, some other groups just exchange information via email.
But for people who are going through this, the important thing to know is you're there to help, and you understand, because whether it's a family member or someone who's been through it personally, there is help and support out there.
Right, just go to our website, pick up the phone, send an email, and
help is that close.
somebody will call you and talk to you and advise you.
Thank you, Kalina, for being here and sharing your story, and for being a volunteer that's helping other people walk the path that you and your family walk. Thank you.
Thank you so much. Thank you for having me here. And for me, it's just a giving back what I feel that I got from NADF in the first place.
Wonderful.
Thank you.
We will be right back. Don't go away. Is here to share her story, including her battle with a diagnosis of Addison's disease and the impact it's had on her world. Lindy, thanks so much for being with us.
Thank you for having me.
Well, first of all, no one would look at you and think you were suffering from fatigue or anything because you're so young and vibrant. So when did you know something wasn't right? Kind of walk us through your story and how you got from I'm not sure this is what I'm supposed to be feeling to the diagnosis of Addison's.
Right. I've always been a very active person and just going nonstop. And it got to the point where I couldn't go nonstop. I literally couldn't go across my apartment floor without just being exhausted. And I ended up having to call and ask for help. And my mother came down and stayed with me for a while, and she was like, there's just something wrong. So I started going to doctors, and I'm like, I don't know what it is. I'm just tired. I just don't feel good. There's just exhaustion. And my general practitioners couldn't figure it out. They were basically just telling me, oh, well, you're a little fat and you're kind of depressed. And I'm like, but I'm really not.
Wow.
You know, I know this is not right. And I couldn't get answers. And I started noticing at work too, you know, just total mind fog. Like I just sit here and just be like, oh wait, I need to do something, and forgetting everything, and it's just not me.
I would imagine that was pretty scary, because did things just kind of escalate, or
Absolutely. And it wasn't anything major. It wasn't anything that you could really pinpoint. It was just a whole lot of very vague symptoms that were getting extreme, and it honestly, it got to the point where I sat down and wrote a letter saying goodbye to my family, because I'm like, I know something's wrong. I know this is the end of my life, but I can't get anybody to listen to me.
What was the turning point?
I actually came to work and was just talking about not feeling good, and they were noticing some changes at work and everything, and my boss recommended a different doctor, one that he trusted and had been to, and I went there, and they said, you know what, this is not right. And it just changed everything for me to say, okay, I'm not just making this stuff up. This is not in my head. it is actually something that I'm, not able to just push through and get things done. That something was actually going on.
So now that you've gotten your diagnosis, you found a doctor who said, no, you're not crazy, something is going on. Were you put on medication, and what has changed in your life?
Everything about life has changed, to be quite honest with you. It took a while to get it, and my general practitioner knew something was wrong but didn't know what, so he kind of blanketed me out to specialists, and it just so happened within just a few minutes my endocrinologist knew what was going on. And I take medicine every day and twice a day, but it's not, Addison's disease isn't an X plus Y equals Z type thing with medicine. You have to really pay attention to your body. You have to pay attention to stresses, sickness. Everything is variable. So it's really confusing, and you kind of feel like you're a science experiment a lot because nobody can really give you straight answers.
But they finally got it right with you.
We're still working on it. Okay. Actually, it's going to be a lifetime because your body changes, your environment changes. So it's not something that you'll be on the same dose forever. It will kind of adjust with situations.
What's the biggest difference now that you know what's going on and you've got the medication?
I can't just keep going and pushing through. Everything about my lifestyle has had to change. I have to schedule out time to rest, and I have to start telling people no. And at the end of a work day, sometimes I have to cancel dinner plans and do that kind of stuff. So there's a lot of give and take about life, and I just have to slow down. It makes you appreciate everything a little bit more, though.
So what would you say to someone who's perhaps recognizing themselves in what you're talking about right now?
Well, there's a lot of signs that can be kind of with anybody. But there's certain signs that are Addison specific. There's going to be pigment changes in your skin. There's going to be exhaustion. There's going to be blood pressure. There's going to be pain. There's going to be a lot of things that you can pay attention to. But when you put them all together, it kind of comes up with Addison's disease. And if you see these things going on, go to the doctor. This is a disease that'll kill you. If you don't pay attention to it, if you don't get treated, you can very rapidly go into crisis and die. So it's very important to go and insist on it. Absolutely insist on getting checked. You're going to be your best advocate. Doctors may not know what's going on and they may not pay attention to you, but you have to keep insisting.
So you have to be your biggest hero here.
Absolutely.
And say, no, it's not all in my head. There's something wrong, and I'm not going to stop until I get the answer. So I think you've helped a lot of people by sharing your story, especially folks who look at you and go, my goodness, she's so young, so maybe I'm not supposed to be Superman or Superwoman. There's a balance, and I need to find it.
You can still be Superman or Superwoman. You just
have to schedule it.
You have to schedule it out.
Okay. Lindy, thank you so much for sharing your story with us.
Thank you very much.
And good luck.
Thank you.
We'll be right back. Don't go away. As we've heard today, being tired and overwhelmed can be more than what it appears. Don't gamble with your health. If you feel tired, weak, and it's persisted, see your doctor and don't stop asking questions. We want you to be around to enjoy your healthy connections. I'm Annetta Wilson. Thanks for joining us. We'll see you next time.